Hello farmers, I am Mr. Jarpum Gati.
And I am Mr. Magatame.
Today we are presenting on infectious bursal disease IBD.
Also known as Gumboro disease.
IBD is a highly contagious virus infection characterized by rapid bursal lesions, hemorrhagic myositis, high mortality, and severe immunosuppression. It was first recognized in 1952 in Gumboro, USA, and later reported in Uttar Pradesh, India in 1971.
The causative agent is a virus belonging to the family Virnaviridae. The virus is non-enveloped, has double-stranded RNA, and is highly resistant to environmental conditions. It can survive even at high temperature, making it difficult to eliminate.
The main route of transmission is fecal-oral, and the infection spreads through contaminated feed and water, infected droppings, equipment and human handlers, wild birds and vermin, but there is no vertical transmission.
And for gross pathology, the bursa of Fabricius is the main site of infection. It appears swollen, congested, and hemorrhagic, with edema and sometimes pus. These changes leads to destruction of lymphocytes, causing immunosuppression. In muscles, we see petechial hemorrhages, especially on the chest. The kidneys are swollen with urates, and the spleen is enlarged, and the intestines show excess mucus. This indicates systemic spread of the virus. And a key diagnostic sign is hemorrhage at the proventriculus gizzard junction. This is a hallmark lesion seen in acute IBD. These findings are important for quick diagnosis during outbreak.
These are the external clinical signs of IBD, which are easily visible to farmers. Affected birds show depression and inactivity with ruffled feathers. They develop watery diarrhea, often soiling the vent, and show loss of appetite. As the disease progresses, birds become weak with drooping wings and may show dehydration with sunken eyes. They also tend to huddle together abnormally, and in severe cases, there is a sudden increase in mortality, especially in birds aged 3 to 6 weeks. Early observations of these signs is crucial for timely intervention.
Vaccination is the most effective method to control infectious bursal disease. The vaccines can be administered through eye drop, which is the preferred method, and spray or through drinking water. There are two main types of vaccines: live attenuated vaccines for young birds and inactivated vaccines mainly used in breeders.
The most commonly used vaccine for IBD in veterinary practice is Georgia strain, which is a live attenuated vaccine, which is mixed with a diluent and administered in the bird via various routes. Vaccination is usually done at day old, followed by a booster at 14 to 18 days. Depending on maternal immunity, it is important to maintain the cold chain, use clean water, and vaccinate only healthy birds. Proper vaccination helps prevent outbreaks and reduces economic losses.
For diagnosis of IBD, check for clinical sign, conduct postmortem, compare the bursa of infected with the normal bird for any swelling or damage. One can also use a rapid field test. For confirmation, send sample to a lab for tests like ELISA or PCR. If IBD is suspected, isolate sick birds, maintain hygiene, and ensure proper vaccination.
To conclude, infectious bursal disease IBD is a serious threat to poultry health. Early detection, proper vaccination, and good management are essential for effective control.
Thank you.